Welcome to SATU Career 2.0 online nursing channel. In this video, we are going to discuss 25 questions with rational. Our experts have selected totally 100 questions. In each video, we will have 25 questions for RRB Staff Nurse Exam 2019. Before seeing these videos, please subscribe to our channel. To get latest notification, please click the bell icon also. Let's see the first question of the day. Benign tumor of bone is option A. Osteoma, B. Ewing sarcoma, C. Rhabdomyosarcoma, and D. Osteogenic sarcoma. The right answer, option A. Osteoma is called benign tumor of bone. The rationale: osteomas are benign head tumors made of bone. They are usually found in the head or skull, but they can also be found in the neck. While osteomas are not cancerous, they can sometimes cause headaches, sinus infections, hearing issues, or visual problems. However, many benign osteomas do not require treatment at all. Question number 2. Gons foci is seen in option A. Rheumatic fever, B. Measles, C. Renal tumor, D. Tuberculosis. The right answer, Gons foci is seen in option D. Tuberculosis. The rationale: a gone lesion, sometimes called gone focus, represents a tuberculosis susciting granuloma, or it is also called tuberculoma, and it represents the sequelae of primary pulmonary tuberculosis infection. Commonly, we call it as primary complex. Question number 3. Normal pH of semen is A. Acidic, B. Neutral, C. Alkaline, D. Morning acidic and evening alkaline. The pH of semen is normally alkaline in nature. Option C. Alkaline in nature is the right answer. Normal pH of semen is alkaline in nature. The explanation: pH is important because sperm dies at pH less than 6.9, which is considered as more acidic. The pH of liquefied semen is tested normally using test strips. Normal pH of semen is between 7.2 to 8.4. Inflammatory disorders of accessory glands can take the pH outside of this range. When the pH of semen goes below this range, that is considered as abnormal. Question number 4. Risk factors of autoimmune thyroiditis. Option A. Diabetes insipidus, B. Diabetes mellitus, C. Systemic lupus erythematosus, and D. Myasthenia gravis. The Hashimoto's disease, also called as autoimmune disorder of thyroid gland. So the right answer, the risk factor here is diabetes mellitus. The rationale: Hashimoto's thyroiditis is an autoimmune disorder, so the main risk factor for developing this disorder is having a pre-existing autoimmune condition. In the case of Hashimoto's thyroiditis, immune cells attack the thyroid gland, causing it to become inflamed and impairing its ability to produce enough thyroid hormone. Some of the common examples of common autoimmune disorder which causes Hashimoto thyroiditis includes A. Addison's disease, rheumatoid arthritis, and type 1 diabetes. So we can select diabetes in this question. Question number 5. All the following are feature of Parkinsonism except A. Mask-like face, B. Restive tremors, C. Preserved postural reflexes, and D is rigidity. So all of the following are features of Parkinsonism except one among this is not the signs and symptom of Parkinsonism, that is option C, preserved postural reflexes. We know very well in Parkinsonism the reflexes is affected, it is not preserved. Classical signs and symptoms of Parkinsonism can be kept in mind with this mnemonic SMART. S stands for shuffling gait, M stands for mask-like face, A stands for akinesis or rigidity, and T tremor. Tremor is the most common signs and symptom of Parkinsonism. Tremors occurs at rest. Impairment of postural reflexes is very common in Parkinsonism disease. In this, there is no what we can say. The postural reflexes is not preserved. Question number 6. Diet of fracture patient should be rich in A. Magnesium, C. Calcium, C. Potassium, and D. Sodium. Diet of fracture patient should be rich in option B. Calcium. The rationale behind this: calcium is one of the main bone forming minerals, and an appropriate supply to the bone is essential at all stages of life. Since calcium is the primary mineral in the composition of human bone, it comes as little surprise that it plays the central role in recovery from bone fractures or other bone injuries. Foods high in calcium includes dairy products such as milk, cheese, and yogurt, almonds, green leafy vegetables, pulses, soy products, and cruciferous vegetables including broccoli, kale, collard, and mustard, and turnip greens. White sesame seeds are believed to be one of the excellent sources of calcium. So, for a client with who is recovering from bone fracture, should take more amount of calcium in his diet. Question number 7. Drop factor of pediatric drip set is A 16, B 20, C 30, D 60. The drop factor of pediatric drip set is option D 60. The rationale: drop factor is the number of drops in 1 milliliter used in IV fluid administration. A number of different drop factors are available, but the commonest are 10 drops per ml is used in blood set, 15 drops per ml is used in regular IV set, that is considered as macro drip. 60 drops per ml is a micro drop or it is micro drip, that is a pediatric drip, that is considered as a pediatric drip. So the right answer is option D 60 drops. Question number 8. Vector of dengue fever is A. Anopheles stephensi, B. Anopheles gambiae, C. Aedes aegypti, D. All of the above. The vector of dengue fever you know very well. Option C. Aedes aegypti. The rationale: the Aedes aegypti mosquito is the primary vector of dengue. The virus is transmitted to human through the bites of infected female mosquitoes. After virus incubation for 4 to 10 days, an infected mosquito is capable of transmitting the virus for the rest of its life. Question number 9. In a multiparous mother, the duration of third stage of labor is option A 10 to 15 minutes, B 15 to 30 minutes, C 30 to 45 minutes, and D is 45 to 60 minutes. So the third stage of labor in a multiparous mother, the duration is 10 to 15 minutes. Maximum it can be 15 minutes. The third stage of labor starts after expulsion of fetus to expulsion of placenta and membrane. The duration of primigravida is for 15 minutes. In multigravida, it is 5 to 15 minutes. Commonly, in 5 minutes, it can occur. Active management of third stage of labor, the time duration is 5 minutes. We all know very well. Question number 10. Typical signs of tuberculosis includes A. Night sweats, B. Weight loss, C. Persistent cough, and D. All the above. The signs of tuberculosis includes all these three. So option D, all the above is correct. We know very well Apart from this, the other signs and symptoms of tuberculosis are coughing that lasts 3 or more weeks, coughing up blood hemoptysis, chest pain or pain with breathing or coughing, unintentional weight loss, fatigue, fever, night sweats, chills, loss of appetite. Question number 11. Coke pouch is used in A. Colostomy, B. Liver cirrhosis, C. GERD, gastroesophageal reflux disorder, and D. Ileostomy. Where we use the Coke pouch. It is used in ileostomy procedure, and Coke pouch procedure is a procedure to treat inflammatory bowel disease. During Coke pouch ileostomy, we connect the end of your small intestine, that is ileum, to the outside surface of your skin by making a permanent opening called stoma. Your stoma has no nerves, so you will not feel any sensation if you touch it or something rubs up against it. So, Coke pouch is used in ileostomy to treat inflammatory bowel disease. Question number 12. Ocular tonometry is a procedure for A. Measuring intracranial pressure, B. Measuring intraocular pressure, C. Measuring intrapleural pressure, and D. Measuring muscle tone. Tonometry. Ocular tonometry. It is a procedure used to check the intraocular pressure. Tonometry is a procedure in eye care professionals use to determine the intraocular pressure, that is the fluid pressure inside the eye. It is an important test in the evaluation of patient at risk of glaucoma. Most tonometers are calibrated to measure pressures in millimeter of mercury. So you understand, tonometry is a procedure used to check intraocular pressure. It is used to detect whether a patient is at risk of cataract or not. Question number 13. Dose of oral vitamin A supplement recommended for children in age between 6 to 11 months of age, including HIV positive child. Option A, 1 lakh international unit, B, 2 lakh international unit, C, 50,000 international unit, and D, 25,000 international unit. So here the infant age 6 to 11 month, the dosage of oral vitamin A supplement must be option A, 1 lakh international unit. When when the child age is more than 12 months up to 60 months, we can give 2 lakh international unit of oral vitamin A supplement. Question number 14. Use of oral contraceptives increases which type of cancer? A. Cervix, B. Breast, C. Ovary, D. Endometrium. Oral contraceptive pill usage increases the risk of breast cancer. The explanation: research shows that taking the combined contraceptive pill, which contains estrogen and progesterone, can increase your risk of breast cancer. There is also increased risk of cervical cancer, but breast cancer gets the priority. Question number 15. Image based question. The machine seen in this image is A. DVT pump, B. Infusion pump, C. Blood warmer, and D. Syringe pump. The image shows the infusion pump. Question number 16. The first aid treatment for choking is all except A. Put your fingers in their mouth, B. Ask, are you choking? Option C. Encourage the victim to keep coughing, D. Lean the client forward. So here we should not put the fingers in the patient mouth. So option A, put your fingers in the mouth of the patient is not the treatment of choking. Whereas We have to ask the client, are you choking? We must encourage the client to do coughing, and we must make the client to lean forward so that the materials can come outside. Putting your fingers in patient's mouth will push the obstructed object further inside the airway. So option A is correct. Question number 17. The safe site in adults for the administering intramuscular injection is option A ventrogluteal site, B vastus lateralis site, option C dorsogluteal site, and D is rectus femoris, which is the safest site of administering intramuscular injection in adult. Option A ventrogluteal site is considered as the safest site for administering intramuscular injection. Ventrogluteal site is the safer option which accesses the gluteus medius muscle. That is a primary location for IM use as it avoids all major nerves and blood vessels. Hence, we select ventrogluteal site as the safest site of administering IM injection. Question number 18. Hand and foot syndrome is a side effect of which anti-cancer drug? Option A vincristine, option B capecitabine, option C methotrexate, option D vinblastine. The anti-cancer drug which causes head and foot syndrome is option B capecitabine. The explanation: head and foot syndrome is also called palmar plantar erythro erythrodysesthesia. It is a side effect of some cancer treatments. Hand-foot syndrome causes redness, swelling, and pain on the palms of the hands and soles of the feet. Sometimes blisters appears. Head-foot syndrome sometimes occurs elsewhere on the skin, such as knees or elbows, but this is less common. This is the common side effect of the drug called capecitabine. Question number 19. Doubling time of HCG is option A 24 hours, B 16 hours, C 72 hours, D 36 hours. The doubling time of HCG is 72 hours. Doubling time for HCG are a good way to check whether a pregnancy is progressing normally until about 6 or 7 weeks after your last menstrual period. In a typical pregnancy, your HCG level should double for every 72 hours. Question number 20. Corrigan's pulse is characterized by all except. Corrigan's pulse is characterized by all except option A marked arterial pulsation, B palpable at the carotid or temporal arteries, option C abrupt rise in the systolic pressure because of large stroke volume, option D results from the decreased force and volume of the blood ejected from the hypertrophied left ventricle. So Corrigan's pulse is characterized by option A, B and C except option D results from the decreased force and volume of the blood ejected from the hypertrophied left ventricle. Corrigan's pulse, you all know very well, it is called as water hammer pulse, or it is also called as collapsing pulse. Corrigan's pulse arises as a result from the increased force and volume of the blood ejected from the hypertrophied left ventricle. It is not occur because of the decreased force. It occurs because of increased force. It is usually found in patients with aortic regurgitation, a condition caused by a leaky aortic valve. The left ventricle of the heart ejects blood under high pressure into the aorta. Question number 21. Oval jelly bodies presence in a client blood is associated with. Oval jelly bodies presence in a client blood is associated with A. Splenectomy, B. Hyposplenism, C. Severe megaloblastic anemia, D. All the above. Oval's jelly bodies are present in all these three conditions. So we select the answer option D, all the above. What is Howell's body? Howell's Oval jolly bodies are histopathological findings on a blood smear. They appear as a dark purple, basically described as basophilic area, spot within the cytoplasm of the red blood cell. If you study erythropoiesis, you know at one stage the nucleus which is present in the RBC will move outside. But in this stage, typically during the maturation of red blood cell in the bone marrow, the nucleus must be expelled alongside all nuclear matter in order to become a mature red blood cell. When you study erythropoiesis steps, we see that at a later stage, the nucleus present inside the RBC will leave outside along with its material. But in this case, that will not happen. However, in rare occasion, the nucleus is not appropriately removed and fragments of the DNA remains as the basophilic dark spots and are called as oval jelly bodies. It is commonly seen in condition splenectomy, hyposplenism, and the condition is related to severe megaloblastic anemia. Question number 22. Which of the following is used in the management of hyperkalemia? A. Potassium sulfate. B. Sodium polystyrene sulfonate. Option C. Potassium chloride. And D. Magnesium sulfate. In hyperkalemia, we use sodium polystyrene sulfonate as the treatment for hyperkalemia condition. We can also use some other drugs like calcium, that is calcium gluconate 10 percentage is recommended. Insulin can be administered in IV. For short acting 10 units can be given. Albuterol 10 to 20 milligram is given in inhalation. Furosemide is given in IV 40 to 80 milligram. Sodium polystyrene sulfonate 15 to 60 gram is given orally, and in rectally it is given as 30 to 50 gram. And latest addition to the treatment of hyperkalemia is Patriomer. It is given orally 8.4 to 25.2 gram daily. It is recently approved by FDA America. Patriomer. Question number 23. What procedure has been done? By seeing the image you can identify. This is stomach before surgery and stomach after surgery. Option A. Rovaxin Y gastric bypass. B. Duodenal switch with below pancreatic diversion. Option C. Nissen fund application. D. Sleeve gastrectomy. By seeing the image, you can tell clearly it is a procedure called Nissen fund application. And during fund application surgery, the upper curve of the stomach, the fundus, is wrapped around the esophagus and sewn into the place so that the lower portion of the esophagus passes through a small channel or stomach muscle. This procedure is often done using a laparoscopic surgical technique. This is a common surgical management of GERD, gastroesophageal reflux disorder. Question number 24. Drug of choice for prophylaxis of meningococcal meningitis. Option A. Ceftriaxone. B. Penicillin. C. Erythromycin. D. Septran. So for treating meningococcal meningitis, rifampin is given, and equal drug which can be alternative for rifampin is option A. Ceftriaxone. Ceftriaxone may provide an effective alternative to rifampin for prophylaxis in people in close contact with patients with meningococcal meningitis. Oily chloramphenicol may be the drug of choice in areas with limited health facilities because a single dose of the long-acting form has been shown much effective than other drugs. Question number 25. What type of traction you seen in this photograph? A. Hamilton-Russell traction. B. Gallows traction. C. Rux traction. D. Balanced skeletal traction. The type of traction you are seeing here is option B. Gallows traction. Gallows traction is seen in this image. Now I will show you what are the other types of traction in the option. This is the balanced skeletal traction which we commonly see in the orthopedic work. Balanced skeletal traction, and this is other two types which we have seen in the option. that is box fraction in the above and a resistance fraction in the below of this image. Now the much weighted subscribers question. Subscriber has to find answer for this question and they will write the correct answer in the comment box below. The type of play exhibited by toddlers where they play by themselves the presence of other children is called A. Passive play, B. Cooperative play, C. Solitary play and D. Parallel play. The aim of giving the subscriber question is to make you to search and create interest in searching the answer for the questions of various nursing officer exam questions. Hope you enjoyed this video. This is going to be helpful for giving the RRB exam. If you like these two videos, please click and you can watch it. Thanks for watching this video. Please like and give comment about this video. Thank you. Bye bye.